Hi, welcome in. How are you doing? I'm sorry that you're having some pain and discomfort. Hopefully by the end of today's visit, we can get you on a treatment plan or get you referred over. You're looking for a referral? Okay. Actually, before we get into this visit, I do just have to confirm your name and date of birth. I know I've seen you before. You're one of my patients, but we always have to do this. So could you please give me your date of birth? Perfect. All right, all set. So it looks like we wanted to talk about some issues with your pelvic region. Can you tell me a little bit about that? Okay, so you've noticed some discomfort when having erections. Can you tell me on a scale of 1 to 10 how bad the pain is? 1 being minimal, 10 being the worst pain you've ever felt. Okay, so it's fairly painful. How long ago has this started? So it's been going on about a month. Okay. Was there something that spurred this pain? Is there an event you can think of? Okay, so nothing really comes to mind of why it started. So tell me a little bit more about this pain. Are you experiencing, say, any burning while urination? So you're noticing some changes in how your penis looks when erect. Okay. Well, off the top of my head, have you ever heard of Peyronie's disease? Okay, yeah. Not many people have, but don't worry. It is a condition where the tissue of the penis gets injured repeatedly and forms scar tissue, and then that scar tissue will affect your penis as it gets erect, and it can cause pain because it can cause curves in the penis, or just the tissue is not able to stretch how it should any longer, and that can cause a lot of pain. Have you had any issues like keeping erections, just issues with ED in general? It can also lead to a bunch of anxiety. Okay. Yeah, so it's kind of starting to sound like that. Yeah, so Peyronie's is caused, well, we'll back up a little bit. We don't exactly know what causes this fully, but the biggest thing is there is scar tissue forming in the spongy tissue of your penis. So your penis is made up of, well, 2 parts of it are made up of 2 tubes of a sponge-like tissue, and inside that sponge-like tissue is a bunch of blood vessels, and when you are getting an erection, those blood vessels fill with blood, and that's what's going to cause the stiffness, firmness, and potentially extra length of an erection. And so when there is scar tissue formed in that spongy material, things are not going to stretch as they normally would. It can cause curves, just tissue, it's not able to stretch and move as it normally would, and that can cause pain. Generally, from what I know of Peyronie's, is that the pain does kind of ramp for at least 1 to 2 years, and this condition does not get better generally on its own. It will need help from a urologist. So I will be doing a visual examination of your pelvic area today and just checking to make sure that it's not another STI or something like that. Okay, so yeah, so I will be taking a look over for you, and then if it is Peyronie's, like I have a little bit of a suspicion it might be, we will get you a referral over to a urologist, and they will be able to help discuss effective treatment plans for you, and I can kind of talk about a little bit of what I know, what those treatment plans would be, but they're definitely going to give you a more in-depth and be able to recommend things that will help you. Yeah, they're going to be the specialists, so they're going to know what's going to be the best treatment plan for you. There are more invasive procedures. Surgery is going to definitely be the most surefire way to know that you get rid of that scar tissue, but there are also injections now. They're newer, so I don't know too terribly much about them, but there are injections. There would be an injection into your penis that would break up the scar tissue, and those are candidates. So when I do the visual examination of your area, you can see if you can feel the scar tissue on the shaft usually. Yes. So now I have a few other questions just to make sure that we are on the right track. Then, when is the last time that you had an STI check? Okay, so we are also going to be doing that today. I will be taking a urine sample. Are you able to provide one right now? Perfect. Okay, so there is a restroom attached over there, so I'll just have you go step in there. I will step out of the room to give you full privacy. There will be vials in there, and then a sticker, and there should be a pen in there as well. Just write your name, date of birth, and then leave it in the window for the nurse. So I will have you do that, and that way we can get you checked for any other potential STIs that could either be the actual cause of your problem, or also hindering you with this other condition. Okay? Yeah, so just go in there and I will step out. Okay. Hi. Are you all right? All settled in? Okay. Perfect. So I'm going to get that sent back to the lab, and we're going to get that worked out very quickly so we know by the end of this visit whether or not you have any STIs. Okay? Yeah. No, our labs are very quick here. So, again, you said you hadn't noticed any burning or painful urination, correct? Okay, good. Have you noticed any discharge from your urethra? No? Okay. And have you had any pain anywhere else or any other time during the day when not having an erection? Not really? Okay. And have you noticed any trauma? I know usually people who have a Peyronie's condition don't necessarily know the exact cause, but maybe you would know if you've had repeated injuries to your pelvic region. It could be from sports, even vigorous sexual activity can cause the injury and thus the scar tissue. Yeah, okay. So nothing really comes to mind. Okay. Like I said, most people don't have a specific injury that they remember when having this. There are a lot of different factors in why some people experience this and others don't. We don't fully know what Peyronie's disease is caused from, but it could be, people say, a genetic thing. It runs in your family. That could make you more susceptible to these type of plaques or scar tissue. Yeah, that is what they're referred to as, so don't be confused. They're not the same as, say, a plaque on your teeth or in your arteries or blood vessels. It's just, they use a similar word, I know, just to make things more confusing. All right, so I'm gonna hop in. We're gonna listen to your heart and lungs real quick, if you're okay with that. Perfect. Just to double check that everything else is doing all right at the same time, just so I get a baseline of vitals. Amazing. So I'm just gonna have you sit still for me, and I'm gonna listen to your heart first, okay? So I'm gonna get a little closer to you. Good. I'm gonna listen to your breathing. If you just take a deep breath for me. Good. And again. Good. And the other side. Good. And one more time for me. Good. Okay, all of that is sounding perfect. Put the stethoscope back on, and then I'm going to get a reading of your blood pressure. So I have this blood pressure cuff. It's going to be an automated one. You've used these before. Perfect. Then you know what's going to happen. So I'm going to set the machine part down here. I'm going to get the cuff onto you. If I could just have your arm, please. Yep. And then just sit back, relax. Cuff on. There you go. And if I could have you uncross your legs. And again, just arms out. Sit back, relax. It'll only be on for a few moments. Okay? Looks like we got that reading. I'm gonna get this off. I know it can be a little tight. There you go. Get the pressure off your arm. Perfect. It looks like your blood pressure is normal. Good. Okay, put that down. So it looks like overall you are a healthy individual. Just a couple more questions. When is the last time that you were sexually active? Okay. And again, are you sexually active with more than one partner? Okay. And are you using protection? Good. Okay. So that is sort of ruling out some of the STIs that we would expect. And again, your testing should be back shortly, and then that will fully roll out any of those for us. But while we're waiting on those results, we're just going to head straight into the physical examination. So if you're ready, I will step out again. You can undress. There are gowns, but I'm going to have you undress from the waist down. You can leave socks on, that's totally fine. Whatever you're most comfortable with, and then we will just hop into the examination, okay? Perfect, I will be right back. Okay, let me just get hand sanitizer on, and then gloved up, and we will get on with the next portion of the exam. So I'm going to start just by visually examining the area. So your pelvis, your penis, your testicles, etc. And then we will move on. I will do some palpating. And I'm just going to be looking for any scar tissue and feeling for any scar tissue. And you haven't, again, no memories of recently having any trauma to your penis or pelvic region? Okay. Let me get out my light, and I am going to visually examine the area. So other symptoms, yes, can be even a curve to the penis, shortening of the length than you would normally. Other signs, some people have noticed a narrowing of their penis as well when getting an erection. So you've noticed a curvature to it. Okay. All right. Yeah, everything is looking good so far. So now I'm going to take a look under on the testicles. So I'm going to lift your penis out of the way. So are you okay with that? All right. So I'm just going to move this up and out of the way. We're just going to take a look. You haven't noticed any pain in your testicles at all? Okay. All right, now I'm going to start with the palpating. We are going to start up in your abdominal region first. They go now. Okay, so I'm just going to do some light tapping on your stomach. And let me know again if you're experiencing any pain, okay? Let's go. Good. 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 Any pain there? Anything there? Good. Good. Okay, now I'm going to move on to palpating your penis. I'm going to first go down the sideways length of your penis like so, and we'll be doing light squeezes. Again, I'm looking for any lumps, bumps, anything that shouldn't be there. The scar tissue is going to feel like a little bit of a bump, sort of. It'll feel a little flatter usually, than other bumps that I would be looking for to screen for, say, a cancer or something. And this, again, is completely a scar tissue, not a cancer. So it's very, very different. No need to worry there. Yeah, so I'll just palpate down the length, and then we will flip and do from top to bottom. Okay. All right. So I am going to just be handling your penis. Okay, so just please hold still for me. Thank you, you're doing great. And again, there's no need to be embarrassed. You're doing absolutely fine. Okay, and again, if there's any pain, let me know. Okay. Anything tender there? A little bit. Okay, yeah, I am feeling some of the scar tissue seeing on your left side. Okay. Yeah, and are you noticing a curve in that direction? Okay. Okay, yeah, looks like we've located some of the scar tissue. Okay, yeah, see, and can you even see right down here? Yeah, you can kind of see how it almost, there's like a little ridge. So that's going to be the scar tissue. Yeah, okay, so now I'm going to do from the top and bottom. How are you doing on pain? Good? Okay. Okay, not noticing anything just on your left side. So that looks like what's definitely going to be contributing to the curvature that you're noticing. Yeah, it does look like I'm seeing about a centimeter of visual scar tissue on that left-hand side of yours. Okay. Yeah, and you are experiencing some light pain when it is touched. Okay, here. How about when I do that on a scale of 1 to 10, how painful is that? Okay, and how about this? Okay, and how about now? All right. Yes, so it does look to me like we have a case of the Peyronie's disease. Oh, 1 second. Let me see. It looks like the nurse is coming in with your results. Hi. Okay. So everything tested negative on the STIs. Perfect. Okay. Yeah. So everything came back clean from your urine sample. So like I was saying, I do believe we have a case of Peyronie's. Now, get these gloves off. So that being the case, that is my hunch. I am going to send you to a urologist to confirm. So I'm going to write you a referral and we'll get that to you. And let me see, what insurance do you have? Perfect, okay. And I know that this urologist will take that. Okay. So we have your referral, and we'll get that to you in the front. But they're gonna, again, probably take another look at you just to double check my findings and to confirm, because they are obviously going to be the specialist in this area. But once they do that and fully confirm what I'm seeing, they will refer you to either be a surgery candidate or, again, it really depends up to you and how aggressive you're looking to be. You could do, there are injections, or there is a physical therapy option, but looking at your case from my eyes, I'm going to think probably the injections are going to be a better fit for you. But again, it completely depends on how you are looking at treating this. Yeah, how aggressive you want to be, and they were going to be able to give you all of the risks and pros and cons for each treatment. But I just kind of want you to go in knowing a little bit about what to expect. Yeah, so maybe if they don't mention the injections, you could ask about it or such. Okay. Well, I'm glad that we could get you on a treatment plan, or a road to a treatment plan. Do you have any other questions for me? Okay. Yeah. No, so it really depends on their office. I'm not sure what their waiting times are like, but from what I've heard, it's usually not much. I would say a couple weeks out. Yeah, so they should be able to get you in relatively quickly. If that's all the questions you have for me, then you are all set to go. I will step out so you can get reclothed, and then you're free to go, okay? Yes, and just stop by the front. The gals will have the referral to give to you. Okay. You have a good rest of your day. Bye-bye.